Good afternoon, and we are on. It's Ladies' Day here at KROS, and we've gone through numerous guests already, and boy, it's just been really a great time. We've got a beautiful day out there. All these ladies coming in with bright smiles on their face. It is just so enlightening. And our guest this hour, we have Dr. Mindy from Cornerstone Family Dentistry in Comanche, and her assistant, dental assistant, Sally. Welcome, ladies.
Thank you.
Thank you.
And, boy, it's nice to see those nice, bright smiles that you all have. You must work at a dentist office.
We do, and we know how to whiten teeth very well, too.
Yes.
Okay, welcome. And Cornerstone Family Dentistry, you have 3 offices, Davenport, Morrison, and Comanche. And you gave me a little sheet here about some information, and I just really like everything, how you got started. Can you share that with us?
Yeah, so I'm Dr. Mindy, and I'm the one who actually started Cornerstone Family Dentistry. So I worked as an associate with another dentist for about 4 years when I knew that I wanted to have my own practice. So I started my own practice in 2014 when I bought a building in Davenport and started a practice from scratch. So when you start a practice from scratch, that means you have some friends and family members as your patients, and that's it. So I had no patients and, just needed to build the building out, with dental chairs and all of that. So while I was in the process of kind of setting the practice up, I was helping a dentist in Morrison, Illinois, who was very ill. And so as I was helping him, probably for a month or 2 months, he actually passed away. So when he passed away, I was in Morrison, and I came to love that community. I grew up in a small town, and so working as a dentist in a small town, it was just amazing, the relationships that I could have with the people and the trust that we were able to build so quickly. So I was really sad to see that, I had already started my practice, that this opportunity wasn't really going to be able to work out. So I thought, ooh, my brother's a dentist. So he was a dentist up in Wisconsin, so I gave him a call one day, and I said, how would you think about moving back down here? And I could buy this other practice, and then that way we would have 2 dentists, so we could split, between the 2. And he took a little bit of convincing. He's a very practical guy, but he finally did it. And so he came to help me, and we bought the Morrison practice, and we acted as 2 dentists with 2 practices for a very long time. And then we ended up getting an associate. I think it was 2021. And then in 2022, we heard about Dr. Lowe in Comanche, that he was searching for somebody to buy his practice. And really just the reason we even entertained that idea was, again, that same small town pull. My brother and I grew up in a small town. We went to Rockridge High School, if anybody knows where that's at, south of the Quad Cities.
Okay.
Graduated with small classes, under 100 kids.
Yep.
So when we thought about Comanche, we thought, it'd just be so sad for a dentist not to come into that community.
Yes.
And
there was an established business.
It was an established business, too.
Yeah.
So we did end up deciding to bring on another associate, Dr. Monica. So now we have Dr. Monica and Dr. Jackie. We have lots of ladies. And so now we have 3 practices.
Right. And you have your dental assistant here with you, Sally.
And Sally's been here since the very beginning. So Sally,
you started with them, with her also?
Yes.
Sally,
Morrison
talk about
practice.
when you started.
So when I started, Dr. Mindy was working for Dr. Simpson still, and then when she decided to buy the practice, then, because I was going to go to the Davenport office with her originally, and then she ended up buying this one, so then we just kind of rotated together, and then she brought the Comanche practice, and then I moved from Morrison to the Comanche one to get that started with her.
Yeah.
Yeah, so.
Oh, I mean, starting a business from scratch, we know, my wife and I know, that's a huge undertaking, isn't it? Were you a little scared starting out?
I have the right personality for it. So, it was exciting for me. It was thrilling, maybe a bit nerve-wracking at times, but I was a college athlete, and so the thrill of just like the chase of starting a new business it was the same thrill as, you know, like when I was running races and cross country and track. So I think I was kind of built for it.
Yeah, okay, awesome.
Yeah.
So share with us just a little bit about your office in Comanche.
Okay, so the office in Comanche is right next to the community.
The City Hall.
City
City
Hall,
Hall,
yeah.
right next to the City Hall, so we're right there in the middle of Comanche, and we have 3 doctors that rotate through there, so most of the time. So there's my brother, which is Dr. Craig Peterson, there's Dr. Monica, and then there's myself, Dr. Mindy. We're the ones who rotate through there the most, Dr. Jackie very occasionally.
And we're right now open 3 days a week,
Okay.
Tuesday, Thursday, and Friday. We'll be opening on Wednesdays in November, so.
Yep.
it's-
Yep, so we'll be opening up to 4 days a week starting in November. so.
Excellent, so your
Yeah,
we've had some
business
growth.
is growing.
It is growing,
Yeah.
That's
yeah.
excellent.
So we've had lots
Yeah.
of new patients, lots of people figuring out that we treat all different ages. So we treat the young and the old and everything in between. And we have lots to offer. So we're able
Yeah.
to do our own extractions. We're able to do lots of very complicated things that maybe some other dentists might tend to refer out. We tend to do it all in-house, which
In-house,
is nice.
Yes,
Right.
which is, yes, nice, they can
Yeah.
come right to you.
Right.
Right, yep. What is different in your office because you're owned by a lady, since we're talking about Ladies' Day?
Ooh, I like this question. So our office is full of ladies. We have all ladies except for my brother, Dr. Craig Peterson, which has to
Yes.
be a special kind of male to handle
Yeah.
all the ladies in the
Yes.
office.
This is true?
Yes. And we have my dog. He comes to work with me. He also is a male. He's a therapy dog in training. Not quite to the point where we can bring him out with lots of patients, but he loves seeing all the staff and the UPS guy that gives him treats and all of that.
Yeah,
So
I love
Yeah.
therapy dogs. They're
Yeah.
always just
Yes.
so kind and gentle.
yes,
Yeah.
he is. He's very, very sweet.
And the kids love them. So.
Oh, the kids.
Yeah.
Oh,
Yes.
the
yes,
kids,
yeah.
yes.
They love him. So we're just made up of a group of women that have become, and my brother also in there. We've just all become very connected, and we love each other, and we feel like family. We live by core values. So in our practice, that's one thing I feel like we've done very well, is we've decided what our values of the practice are, and we make every decision based around those values. So our 3 values are that we put family first. So
Okay.
family goes ahead of our business. And my brother and I decided that very early on.
I think that's why we chose the hours that we work.
Yes.
All of us have families and our
Yeah.
mothers, and so it worked with everybody's schedule to be open from 7 a.m. to 3 in the afternoon. So we have the afternoons and evenings to spend with our families.
Right, and that's
Yeah.
so important, family.
Yes,
for sure.
And some of our patients, obviously, that might not work for everyone. And
Right.
But for our patients who are able to make that work, the benefit to them is they come and they see people who are energized, passionate, excited, and just able to be connected to them, have the energy to be connected to them. So I think it's an advantage to our
Yeah.
patients too. They get the best of us during those hours.
And
we
people do love our 7 a.m.s because they can come in before
Yeah,
work.
Right,
Yes.
absolutely.
Yeah.
Yep.
Oh, and our kids especially love it when their parents schedule a 7 a.m. for them before school. The high
Yeah.
schoolers especially.
Yeah.
So family first, and then our other value is willing to wash the dishes.
Oh,
So-
I do dishes.
Yes.
Yeah.
Yes.
Well,
yeah.
it means
I didn't know
basic-
it was that important.
Yes. Well, to us, it means that you're willing to do something that may be different than your job description. So maybe you're a dentist in our practice and we need someone to clean up a mess or put salt on the sidewalk or, help someone, that needs some help walking to the car, just anything. That we're all willing to help each other and to help our patients and go above and beyond and not, worry about what we're supposed to be doing or what someone else is supposed to be doing.
Right.
So we like that one. And then our last one is the golden rule, which just means that we want to treat our patients and each other just like we would want to be treated. And we just try to run a very ethical practice.
Right, and
Yep.
so important for business.
Yes.
Yeah.
Right. Yep, a little bit about your Morrison office.
Morrison office has a very similar feel, I would say, as our Comanche office. We have the same doctors that are in Comanche are the ones that are in Morrison, although we do have Dr. Jackie there occasionally too. So we have all the doctors rotating through there. My brother does a lot of work in the Morrison practice and the Comanche practice with our older population, or sometimes even our younger population that is losing a lot of their teeth. And that's because he does a lot of implant placement. So taking the teeth out, placing the implants sometimes the same day. Just a lot of being able to figure out with the patient, here's where we are, here's where we're going, even on those complex cases where we're going to lose a lot of teeth. Now, I end up seeing a lot of kids. So I see kids in Comanche. We wish we saw more because I think people don't know that we see kids.
Yeah.
In Morrison, they've definitely caught on. They know that we see kids. So I see a lot of kids when I'm there.
Yeah.
Yeah.
All right.
Yeah. And then like the older population that's in Comanche and in Morrison, they like it because then they don't have to drive to the cities or the bigger communities and have to do multiple things. So they can get their teeth out and have dentures and have implants all done in the same place without having to go to multiple different doctors to get it all done.
Everything is in-house, it's local, and they don't have to do the traveling.
Yeah.
Right.
Yep.
And that's a big benefit for them.
And it's nice because not all of us doctors do exactly the same thing, but because there's 4 of us that rotate through, we can cover pretty much everything.
Yeah.
Correct.
Yeah. So, Sally, your feelings about all this? It seems like you've adapted and you're still with them, and you must love it.
I do love it. I've been doing it for 24 years, so yeah.
So obviously it wasn't with them there's years that you were somewhere else.
Right.
But,
yeah. I worked in endo and done root canals and all kinds of different things, but definitely general where we can do everything is where I like to be. Yeah,
right.
For sure.
Interesting. We got lots more things to talk about. We're going to pause right now for weather. And Dr. Mindy, if you would introduce that for us.
It's time now on KROS for the Storm Track 8 weather forecast, brought to you by Premier Home Furnishings.
Winter chill will be easing today, though it's still going to be breezy. At least we've got mostly sunny skies back, and we'll see temperatures into the low 50s this afternoon. Tonight, partly cloudy, not as cold. We'll drop to 30. And for Friday, a little further into the 50s with partly cloudy skies. Mid-50s are likely. With your Storm Track 8 forecast, I'm meteorologist Andrew Stutzky.
Currently, we have sunny skies and a temperature of 48 degrees. Winds are out of the southwest at 20 miles per hour. This weather report on KROS has been brought to you by Premier Home Furnishings.
Premier Home Furnishings. It's their service after the sale and their free delivery and setup in your home that makes them #1. And now they're celebrating 20 years of being in business. They're offering you a great selection of appliances, including Whirlpool, furniture including Ashley, bedroom and living room groups, TVs, electronics, mattresses, lift chairs, and more. Come in, pick out what you like, then enjoy their free delivery and setup in your home. Premier Home Furnishings, 2001 Lincoln Way, Clinton.
The Sawmill Museum will be bringing back our speaker series. Come listen to speakers from around the state to learn about their involvement in Iowa's agriculture and environment. This series will start on February 22nd and run Thursday nights from 5:30 to 7 here at the museum. Our address is 2231 Grant Street in Clinton, Iowa. Admission is free. This event is funded through the Silos and Smokestacks National Heritage Area. For more information, check out our Facebook page or our website at thesawmillmuseum.org for dates and information on the speakers.
We are back on Ladies' Day, and what a great day it's been. Just so many enjoyable businesses have come in, ladies from the different businesses in the area. Right now we're talking with Dr. Mindy and Sally, the dental assistant with Cornerstone Family Dentistry, with offices in Davenport, Morrison, and right here in Comanche. And dentistry is something that is really necessary, but there are some people who struggle to afford it. Do you have options for them?
Yeah, I think we have really great options. What we do in our office is we have a membership plan for those people who maybe can't afford to pay for everything all at once. A lot of our older population tends to get on our membership plan because maybe they're not working anymore and they don't have, traditional dental insurance. So what our membership plan is it's kind of like our own in-house dental insurance. So it comes out monthly. It usually costs about $365 or more, depending on what type of, how their gum health is. So I always think of it as it's like $1 a day to make sure you're getting your cleanings, you're getting your checkups, we're taking x-rays, we're making sure if there's any problems, because that's the key in dentistry. If we can figure out if there's a problem when it's a small problem, it can cost $200, $300 to fix it. But if we don't find that problem until it's a big problem and you're in pain, now you're looking at $3,000 or more, because now we're needing a root canal and we got to build the tooth back up and crown it. So I love our membership plan because it keeps people on track, and they just have to pay for it monthly, and it's much more reasonable when it's just a little bit here and there. So that's what we use for our patients who might have a hard time paying. We also are just very good about understanding that dentistry needs to be catered to what someone can afford. So if they can't afford implants, then that's okay. We're going to talk about other options. If they can't afford to save a tooth with a root canal and a crown, that's okay. We're going to talk about what it looks like to go ahead and have that tooth extracted. And so we're good about making sure we're giving them options, not just the option that we think we would like them to take, but all their options, so that if they do need to have teeth taken out, we take them out right in our office and we can take care of that. And we do have some patients that only come to us when they have a toothache and they need a tooth taken out, but at least we're there to be able to take care of that for them and keep them out of pain.
Yep.
So.
And a membership plan like this is so good for the preventive side of it, right?
Yes, and that's what our membership plan covers, is it really covers the preventive side. The nice thing is when, let's say you do have a cavity and you need something, it still does give you a discount for those services. Like if you need a filling, you'll get a 20% discount. If you need, various different things like a crown, you still get a discount. So it does work nicely.
Okay, you mentioned extractions. What other procedures do you do?
You go on that one.
We also see kids and babies. Dr. Mindy and Dr. Jackie do lip and tongue tie releases. We do crowns, root canals, bridges, dentures, all cleanings, deep cleanings. Pretty much anything in dentistry that you need done, we can do.
Yeah, right.
Honestly.
So
yeah.
we had 4 kids and all 4 needed braces.
That's one thing we don't do.
I mean,
Right,
we've
I
done
know.
Invisalign cases, but we've moved more to go to the specialty.
And,
Yeah.
you're
Yep.
mentioning 2 things here that I've never heard of, or maybe I'm just totally naive, but the tongue tie and the lip tie release. What are those?
Yeah,
What is
so
that
I
procedure?
started doing those probably about almost 11 years ago. And so that is where the frenum underneath the tongue, we all have a little attachment. It's like a string that attaches
Yep.
your tongue to the floor of your mouth. If it's too short, too thick, too tight, if it in some way doesn't allow the tongue to move properly, the first signs we usually see that is an issue is when the baby's born, when they can't eat properly. So maybe they can't breastfeed properly, or they can't take a bottle properly.
Okay,
yeah.
So we have a lactation consultant that actually works with us,
Yeah,
and so
that would
she
be
works with the
before
babies.
Yep.
before the age of even 1, right?
Yeah,
They're one of the
I mean, the
babies,
youngest
yeah.
I've seen is
Yeah.
I've seen a baby come directly from the hospital at 2 days old.
Yep.
Oh,
to have the procedure done.
Yeah,
Yeah.
excellent. Okay. And so that was the tongue tie. What, the lip tie?
The lip tie is very similar. It's basically the frenum that attaches the lip to the gums.
okay.
It doesn't affect as many things with function as far as eating and speaking and all of those things, but it's still something that we need to check. We need to make sure that it's in the correct position, and sometimes we do have to do a laser procedure to release that tissue.
Right. Okay. Yep. We were doing really good on time, and we still are pretty good. Yes. How about your favorite song?
My favorite song is from Garth Brooks. It's called The River.
know a dream is like a river, ever changing as it flows, and the dreamer's just a vessel that must follow where it goes, trying to learn from what's behind you and never knowing what's in store makes each day a constant battle just to stay between the shore. And I will sail my vessel till the river runs dry, like a bird upon the wind. These waters are my sky, I'll never reach my destination if I never try. So I will sail my vessel till the river runs dry. Too many times we stand aside and let the water slip away to what we put off till tomorrow has now become today. So don't you sit upon the shoreline and say you're satisfied. Choose to chance the rapids and dare to dance the tide. Yes, I will sail my vessel till the river runs dry, like a bird upon the wind. These waters are my sky, I'll never reach my destination if I never try. So I will sail my vessel till the river runs dry. And there's bound to be rough waters, and I know I'll take some falls, but with the good Lord as my captain, I can make it through them all. Yes, I will sail my vessel till the river runs dry, like a bird upon the wind. These waters are my sky, I'll never reach my destination if I never try. So I will sail my vessel till the river runs dry. Yes, I will sail my vessel till the river runs dry. Till the river runs dry.
And we are back on Ladies' Day, and we've had just two great guests here with us, and they are Dr. Mindy and Sally, the dental assistant from Cornerstone Dentistry in Comanche, Davenport, and Morrison. And we're about out of time, but one quick question. What's some things that people can do to get less cavities?
Okay, the biggest thing you can do to prevent cavities is stop drinking drinks that have sugar in them.
Okay.
Energy drinks.
So
Yes.
energy drinks, pop, even if it's diet, it has acid in it. Every time you take a drink of any of those sugary drinks, it lowers the pH in your mouth, and it takes 20 minutes for your saliva to rebound after that. So during those 20 minutes, it's so easy for the bacteria to cause cavities. So the people who really get in trouble is if they just sip on it, like say they take it to work and they sip on it, they're not consuming very much, but every 20 minutes, then they're gonna get a lot of cavities.
Yep.
And juice does the same thing for kids.
Okay.
Even if it's watered down.
Yep.
You think putting water in juice is,
But it's
It
really
just is
it's
bad.
the contact time
Yeah.
that we're worried about.
Yeah.
Yeah.
And how about flossing? Does that help?
Flossing helps a lot, and there's nothing that will replace flossing. You know, they talk about the water flossers and the water pick and all of these things, and you just have to learn how to floss and do a really nice job, because if you can't get everything cleaned out from between your teeth, then you're going to get cavities. But if you don't floss and you also don't drink any sugary drinks, then there are some people that I see that can get away with that. But if you don't floss and you drink sugary drinks, guaranteed you're going to get lots of cavities.
Yep.
Amen.
Yeah.
All right. Thank you, ladies,
Yeah,
so
thank
much
you.
for coming in. You've enlightened us with a lot of good information. We thank you. We've been talking to Dr. Mindy and Sally, the dental assistant for her, from Cornerstone Dentistry here in Comanche, Davenport, and Morrison. And boy, I don't know what else we can say other than how can they find you on the internet if they want to reach out to you, or a phone number here for the Comanche or anything? Or
Yeah, you can basically just look online. We have lots of Google reviews, so if you want to see what patients think about us, then just look us up online. It's Cornerstone Family Dentistry. You can look up any of the locations and you can see, the address and the phone number. And we do obviously have a website and all of that. So we'd love to have new patients.
Okay.
Yeah.
All right. That does it. Thank
All
you.
right, thank you.
And now from the KROS newsroom, here is Sydney Ellen.
It's Thursday, February 29th, and here are your local news headlines.